how exactly did you and your department get involved with the vaccination effort going on in Turlock?
Well, that was actually very exciting. It all happened rather quick, but we already have a relationship with Stanislaus Public Health Department as they take our students. They were coming on campus. I was part of a team that was working on that, and I heard they needed students, and I said, we're right here, and it just all clicked together. So I feel fortunate that we have been able to help them out.
And kind of on that note, I know you said they were looking for help, but were you at all nervous in regard to calling on the students, the nursing students you have for help? I mean, not too many people are involved in the nursing program unless they're in the nursing program. So some people might be kind of wary of, oh, why is a student delivering something as important as this vaccine? Was there any nerves for you in calling on them?
This is what nursing does. Our students are in the hospitals, they're out in the community. That's how they get trained. Our nursing students work with other nurses, as well as our faculty who have oversight, and they're with them too in the clinical setting. So this is like another clinical setting for us. And it's a great opportunity for our students to actually be part of something historical, and to really be part of, I guess, realize the magnitude of the situation we're in and know that they can actually be part of a solution.
Is vaccination typically part of the 101 in your course, or is it something they typically be learning in these courses?
Oh, definitely. I mean, nurses give injections all the time, and so being able to give lots of injections, and specifically a vaccination, is all within the realm of what they need to know.
So I think I was reading from the news release that Donna had sent out. You guys started off by practicing on each other, vaccinating each other in order to give the vaccinations. What was that like?
Well, yes, it was a good way to start. We vaccinated each other. Students are obviously nervous. And so that kind of helped, I think, reduce that nervousness. Although the student that gave me the shot, my vaccination, I don't think that helped his nerves at all. Poor guy.
I was just about to mention that. I wouldn't want to be the person who's sticking the needle into the professor. So.
Exactly. They feel very different when it's into each other. And of course, they've had practice on campus. We make sure they know what they need to do to be successful. They were given instructions by the public health department, and then they were able to kind of walk through it, and then they went ahead and did it. So there was lots of, call it, ways for them to practice, and then finally be able to show the success of knowing what to do. And then with dozens and dozens and dozens of people coming through, they got lots of practice.
And let's delve a little bit more into that. Well, actually, before we jump into that, can we talk about what it is that you were doing? Because I know the nursing students were giving out vaccinations. Were you also giving out vaccinations, or were you supervising? What is it that you were doing in those days?
So in my role, I was faculty oversight. So I was watching the students. So the idea was that students actually had multiple roles that they could perform. So they could do intake. They could watch. Sorry, I have to move my. This is what happens when we work from home. My cat decides he needs to be in a room that he doesn't need to be in. Yeah.
Oh, I know that every single time.
The reality of these kind of things. Anyway, so students got to rotate into several different areas. They could draw up vaccinations. They could reconstitute depending on which one they were talking about, whether it was Moderna or the Pfizer. So they were also able to participate in watching after the vaccination. So community, the people would be vaccinated, and then they would be observed for about 15 minutes or 30 minutes, depending on if they had other contributing factors that just needed to be watched. So students could participate in any one of those stations. And I think they like that. They got to see the different roles that were played by public health. And they participated in each one of those settings. They had oversight by faculty. We were there to answer questions, to just watch what they were doing, give them feedback on that, and encourage them as well. I think students really liked interacting with the community. A lot of those people that had that were in line, the day I was there was, I think, 2 weeks ago, Thursday. And a lot of people hadn't been out of their house hardly at all. They said this was one of the first times they've been out. And I mean, people had they were in their wheelchairs, they were using walkers, they had their canes. These were very frail, elderly people from our community. And so I think our students felt very rewarded in being able to help them.
And that's one of the other things I wanted to jump into was that kind of day one rush. I know you touched on a lot of that actually, but if we could talk about it from the other side, because I don't think we've heard a lot about the vaccinators are obviously busy vaccinating during those times, so it's kind of hard to get a hold of them. But for your students, what was it like jumping into that kind of situation? Because it's one thing to be in a controlled setting, to be in a max vaccination clinic like what we're seeing at Stanislaus State, like what we're seeing at Modesto. I can imagine it's a very different environment. Were there any nerves kind of heading into that they needed to shake off, or were they ready to go?
I am sure a lot of the students were nervous. I mean, of course, this is a new clinical setting for them. And, but you know what, they just jumped right in. I think just the excitement of, learning, having an opportunity to make a difference. I think the nerves were lost pretty quickly, and they realized that, that they were learning and that they were enjoying what they were doing.
And I think the biggest question here is what you guys are doing right now is so special. I maintain the opinion that people are going to be looking back at this period of time, that 50 years from now, 100 years from now, however so long. And these names at Stanislaus State, yourself, all the students who are participating in this, they're part of that frontline crew that are putting an end to something that literally turned the world upside down. How do you take in the scope of what you guys are doing right now? What's your reaction to it?
I'm just glad we have the opportunity to participate. And I think the students looked at it like that too. But as they were part of, as they spent the day, we literally worked all day. There was very minimal breaks. We were busy. There is a big gymnasium full of people that all needed to be vaccinated. They needed to be screened, they need to be vaccinated, they need to be observed. There was a lot of work to do. And I think being a part of that, they realized it was something bigger. They saw their community walk in the door, and this isn't something that happens every day. And so I think they really did get the scope of what's going on. They realized this is historic. And when we were helping out that first week, students didn't have clinical sites yet to go to. So in essence, we were all volunteering our time, and we had no problem getting students to come. We had no problem getting faculty. I guess everybody realizes it's time to step up, and they feel good that they can help and do something. It's difficult when we see something going on and you say, but what can I do? And this answer that we can actually do something right now to make a difference.
And even on a smaller note, if we can touch on that, when I talked to CVS about their long-term care vaccination program, the guy had mentioned one of my favorite quotes is that we're bringing hugs back. In large part, that's what you guys are doing also. You're talking about, an age bracket that probably hasn't seen their grandchildren in a very long time. We've asked these people to stay home for almost a year now.
Yeah.
And now it's like, what about these small moments with those people? I I don't know. I don't know how to turn that into a question exactly, but does that resonate with you or your students at all?
Oh, that was, for me, it was endearing to watch the students interact with the community. Right away, they'd invite them over, have them sit down, start talking to them, making them feel comfortable. Uh, you could hear the stories from a lot from the people that came in. Like I said, many of them were our older population. Um, Frail, vulnerable, and they hadn't been out of their house. And they wanted to share that story. They wanted to share that they were nervous about being outside, and they needed reassurance. And I was really proud of the students. They took moments to let the patients talk. They took moments to hear their anxiety, to hear their concern, and then told them they were going to give a vaccination, and hopefully that would get them back to see their loved ones. And I mean, what isn't heartwarming about, first of all, hearing that and then feeling that between the students and the patients coming in. It's what we do as nurses. We make a difference, and we help others.
And just some logistical things here. Can you specify exactly how many nursing students are part of the vaccination effort?
That first week we had about 20 students, and I'm trying to think about six faculty.
And is that going to be a consistent level throughout, or do you see that kind of fluctuating as time goes on?
Our goal is to be there a couple times a week, 1 to 2 times a week, with our clinical students and faculty.
And I
So
think
I'm already coordinating with Stanislaus Public Health, so that we can give them coverage every week.
and what about scalability? Because I know Stan State wants to do like 2,000 vaccinations every single day, 7 days a week. Is that like, is the max output of the nursing program right now? Is that 20 students who can help out right now, or are there some kind of like in the reserve right now?
So I think we can offer, like I said, our clinical students, they have different placements that they can be every week. And so we'll be offering a group of clinical students, which is comprised of 10 students and 1 faculty. So we can probably offer 2 of those every week. At least that's what we're looking to do. So we are kind of aiming for that, at least 20 students and probably a few faculty. So I think we can keep up that, or at least we're going to try to. Like I said, we're confirming the schedule right now.